So again, why is infection control necessary? Because we're going to be dealing with a lot of sick people. We want to make sure that we don't acquire any of these types of infections, so you don't get sick from it, and you are not spreading that type of infection to your friends and loved ones. Okay? Most of the common types of diseases that you may be faced out there includes HIV, tuberculosis, the antibiotic and antimicrobial resistant organisms. Remember we talked about MRSA and VRE? So we'll talk about that in just a little bit. And then hepatitis. Do we all know what hepatitis is? What does it have to do with?
The liver.
The liver. Okay, it's a liver disease. I am more weary about contracting hepatitis than I am HIV. Okay? Because hepatitis is more prevalent in a larger population scale, and the pathogen exists longer outside of the human host. HIV, as far as we know so far up to date, is that it can only survive for hours outside of the human body. However, with hepatitis, it can last for days and even weeks. And if you can come in contact with that, you may also get that infection. Okay? So how do you guard and prevent transmission of infection? We talked about what is known as medical asepsis, right? Infection control. Medical asepsis includes hand washing, a minimum of 20 seconds. Sing to yourself, not out loud, happy birthday, 2 times. What is standard precautions?
Gloves.
Okay, a minimum of gloves. Treating every person that you come in contact with as if they are a carrier of some sort of disease or infection. Even then, I'm not seeing a lot of staff members wearing gloves. I mean, that's very risky. Okay, I'm going to give you the knowledge on how to equip yourself. Whether you practice it or not, it's up to you. Okay? So hand hygiene, that includes hand washing as well as properly lubricating and moisturizing your hand. Okay? Clean work area, remember we talked about disinfection, so before and after you have a patient, you want to clean the countertops, exchange the linens, wipe down your equipment. Those are things in how we can minimize the amount of existing pathogens, okay, as much as possible. Okay, that's medical asepsis. And also disposal of any type of contaminated waste material in its proper receptacle. So basic types of acquired infections. We already talked about nosocomial infections. These are infections that can be acquired in a medical setting or through a medical procedure. Again, we're dealing in an environment where there's going to be a lot of sick people, so we can minimize the transmission of those infections by wiping things down. Okay? But nosocomial infection is acquired in the course of medical care. Iatrogenic infection is more specific. An iatrogenic infection is one that is acquired during treatment or a therapeutic procedure. Okay, acquired during treatment or a therapeutic procedure is iatrogenic infection. And then lastly, you have what is known as a community-acquired infection. And this is where an infected individual who enters a healthcare facility. So this is basically an infection outside of the hospital. That's all it is. You have one that's in the hospital. You have one that's outside of the hospital. Most patients that we get have a community acquired. They get sick and then they enter the hospital. That makes sense? Community acquired. You got it outside of the hospital. All right. So with that said, when you come into the hospital, you come in with some sort of illness, is it again possible to acquire another type of infection or illness?
Yep.
The answer is yes. So how are we going to minimize that? By what? What are we practicing?
AC.
Medical asepsis, guys. That's what we're practicing, medical asepsis. Okay, factors that infect nosocomial infections. We can minimize also the amount of infections within our work environment by understanding these factors. Number one is environment, air circulation, how we deal with the infected individual, how we deal with infected or contaminated objects in your work area. Okay? Can we also be a source of infection as staff workers? Yes, we do, right? Yes, we are. So let me ask you this. When you call in sick to work, are you calling in sick to work because you're really sick, or do you have something fun to do? It's usually because you have something fun or important to do, right? That's when you call in sick, all right? And then you go into work when you're sick is because now you need money to make up for that time that you took off, right? So we do have people showing up to work when they're sick. What we say is if you're sick, stay home. We can survive without you. Because if you think about how this is going to work as a whole, if you show up to work sick, what are the chances that you're also going to get other staff members sick? Okay, so now we're talking about one individual sick versus maybe 3 or 4 getting sick because you came into work. If you're sick, stay at home. Okay. Number 2 is therapeutic regimen. We talked about the pros and cons, both extremes. If you take too many antibiotics, again, if you're sick, give your body a chance to heal itself. Don't go straight to the doctors and get antibiotics. Because each time you take antibiotics, you are raising the threshold of its effectiveness. The more antibiotics you take, the stronger those germs can get. You can have superviruses. Have you heard of superviruses? Okay. You're actually giving them a chance to get stronger. The other extreme, if you don't stick to your antibiotic regimen, if it says take every day for 5 days, you take it every day for 5 days. You don't stop because you start feeling better, because what you've done, if you stop ahead of time, there are still surviving germs and you're giving them an opportunity to get stronger and rebuild, okay, and multiply. The equipment that you use, dirty equipment and instruments, wash it down, disinfect it. Contamination. During medical procedures, a break and sterile techniques in which infectious organisms can be introduced to the body. One of them is through wounds. Okay? If you are not clean, if you're not using gloves properly, and you can come in contact with the patient's wound during a dress change, you can even infect that wound even more. But if it reaches the blood system, the circulatory system, then infection can be spread in another location. Invasive procedures. We do a lot of procedures, especially in the radiology department. Remember, guys, as technologists, you're not just taking pictures. You're not just taking x-rays. You're not just doing scans. A lot of the things that we do in the radiology department is interventional. We do a lot of therapeutic procedures. Did you guys know that? We actually get down and dirty. We just don't take pictures, guys. You're going to be involved in many type of surgical type of procedures where you will be right there directly on an open skin. Inserting things, removing things. Therapy, invasive procedures, that is what we do in radiology. A lot of the stuff that we do now used to be done by surgeons, other types of doctors, nurses. We do those now. Okay? Our responsibilities and accountability have leveled up tenfold. Okay? So anytime you're doing an invasive procedure where there is a break in the skin or mucus barrier, what is the number one line of defense?
Skin.
It's going to be your skin. However, there will be some procedures in which requires us to break the skin for the insertion of different types of catheters. Okay? Long-term appliances such as PICC lines. We talked about overglorified IV lines. Let's skip here for just a moment. Okay, here's your PICC line. Okay, it's a PICC line. It stands for peripherally inserted central catheter. Peripherally inserted central catheter. Your basic and typical IV lines may only last for a few hours, a day, no more than a couple of days. Okay, they'll wear out. But those IV lines are designed for short-term use. Okay, because we expect that you'll be well within a couple of days. However, for the very sickly type of patients, we're going to be using over-glorified IVs. This is a PICC line. This catheter is inserted through a vein in your arm, in your chest, or in your neck. Okay, and the tip of that IV line sits in the large vein by your heart. That's known as your vena cava. Okay, so it actually runs from here all the way to your heart. We insert these in radiology. We do these. Okay, but these will last not just days, they'll last for weeks, months, or even a year. So these can stay in here for a long period of time, but now here's the catch. There's still an artificial opening there. And as long as there is communication between the outside world and the inside world, is there a chance for an infection?
Yep.
Yes. Here's another one here. This is called a Quinton catheter for those who are having dialysis. Their kidneys failed. Okay? So the kidneys don't work anymore. What's the whole purpose of the kidneys?
To filter out your blood.
To filter blood, right? You guys remember that? The whole purpose of the kidneys is to filter blood. Blood goes into the kidneys, they get cleaned out, get rid of the waste, goes back into the kidneys, and goes back into our circulatory system. It's clean. It gets rid of any of the waste and toxic material in your blood. If your kidneys don't work, how are you going to get rid of those toxins? Well, we'll do it by way of putting a Quinton catheter. The Quinton catheter we place in the jugular vein. Did we talk about the jugular vein? Okay. The jugular vein is a vein. What movies do is that when somebody gets sliced in the neck and they're grabbing their neck, you got blood squirting out between their fingertips. Okay? They're saying, "Oh, I cut my jugular."
It's the carotid.
That's the carotid that you cut, not the jugular. The jugular is a vein. So we'll place this tube or catheter down the patient's neck. The diameter of this catheter is almost twice the size of the diameter of this pencil. Down your neck, down your chest. Okay, those are the two major areas. So you got two ports here. There's two ports. One to remove the blood. It goes into a dialysis machine to get cleaned out. Okay, and then it gets pumped back into the patient's body through the other port. But now it's cleaned. Okay, so anyone who has kidney failure or renal failure, they'll have dialysis every 2-3 days. Okay, to get rid of the toxins. We also insert these in radiology. Okay, again, it's not all about doing diagnosis. We're also saving people's lives. Okay, and then portacal, a special port that we put underneath the muscle. So we're cutting the muscle, cutting the tissue of the muscle. We're inserting this port underneath the muscle. Close up the patient, and now they can get chemotherapy through this special port, someone who has cancer. And then you have your urinary retention catheter. Again, what I'm trying to portray here is anytime you have communication from the outside and inside, there's a great chance of you getting an infection. Okay? However, we got to choose the lesser of the two evils. You're increasing your chances of infection, but these are life-saving devices. You guys follow? So with that said, if they are going through this type of procedure, they may also be receiving some antibiotic to make sure that they don't get infections on the site. Make sense? Okay? All right. Social and economic factors that can contribute to someone getting sick, someone getting ill. The young and the elderly are more prone to getting sick. The young, they're building their immunity, right? Whereas the elderly, their immunity starts to break down. So those two age categories, the young and the aged, are the ones who are more prone to getting sick. Number 2 is hereditary, okay? You can have congenital or you can have bad genes, and now you are carrying those bad genes and you are more susceptible in getting sick than someone who has good genes. Okay? Nutrition. If you have a poor diet, if you're eating foods with a lot of preservatives, a lot of sugar, things of that nature, the advice is you want to eat things that are colorful, lots of color, right? That's why I like Skittles and I like M&Ms. They're perfect, right? But what they tell you is eat something with color, fruits and vegetables. Okay? Those are the ones that carry a lot of nutrients, minerals, vitamins, things that are necessary in the building of your new cells, but it also fights infections. Exercise, okay, that's also a given. Okay? A lot of hard work and a lot of exercise, you're able to fight those infections a lot better than someone who may be a couch potato. Okay? You know what I got on my phone? I've downloaded the app. You guys know Pokemon Go? That's how I get my exercise. So I go out, it forces me to go out and I start catching Pokemon. Okay? It's a good thing. Stress. Stress, stress, stress. We know that stress breaks down your immunity. We also know that it is very bad on your heart and your heart vessels. Okay? It is a contributing factor to people getting sick. Stress, your love life, finances, your relationship, your kids, your school. All this adds to stress. Okay? Inadequate rest. You need to have anywhere between 6 to 8 hours of sleep a night. That's a given. Because you need your body to rejuvenate. If it doesn't rejuvenate, you're breaking down your immunity and there's a greater likelihood of you getting sick. Personal habits, drug, alcohol, dangerous sexual practices. Okay? Health history. If you have some sort of disease already, whether it be diabetes, heart disease, chronic lung disease, any type of pathology, that will decrease your response to infections. If you're already sick, there's a likelihood that you can acquire secondary infections. Inadequate body's defenses, broken skin from burns and or trauma, surgical and medical interventions, and also the therapeutic regimen. We've already discussed all these. So these are all contributing factors to someone who may be a little bit more susceptible to getting ill. Okay? Any questions so far? The bloodstream and the urinary tract are the most common sites for nosocomial infections. I repeat, the bloodstream and the urinary tract are the most common sites of nosocomial infections. Okay? Because it is systemic. It's not isolated in one area. When we're talking about the bloodstream, if you get an infection, that infection can travel to different parts of your body by way of the bloodstream. Same with the urinary tract. The urinary tract and the bloodstream are closely related. You guys agree?
Mm-hmm.
Because it's the kidneys, the urinary system, that cleans and filters out the blood. So if you have an infection in your kidneys or urinary system, it will make its way back into the bloodstream. Does that make sense? Vascular access devices such as PICC lines, dialysis caths, and porta caths, and also retention urinary catheters will also increase the likelihood of causing an infection. Okay? Because now we've created communication between the outside and the inside. How are we going to minimize that? By constantly cleaning the site and also possibly putting the patient on what? And antibiotics. Okay, let's talk about microorganisms. Microorganisms that cause infections, what are they called?
Pathogens.
They're called pathogens. Microorganisms exist, they will exist, and like the yin and the yang, you've got good microorganisms and you've got bad microorganisms. Those that are bad, that can cause sickness and even death, are known as pathogens. 4 characteristics of these pathogens. Number 1 is invasiveness. What is their ability to infect the individual? They can be strong and lethal, or they can be weak, or they can be dormant. This is their ability to infect. Number 2 is the pathogenicity, is how dangerous or lethal are they? How dangerous or lethal? They can be super viruses, or again, they can be very weak types of germs. Virulence is the ability to grow or multiply. Some multiply very rapidly, while some don't multiply or divide at all. Okay? But those that rapidly divide are the ones that we have to be more cautious about. And we'll talk about that here in a bit. Specificity is the attraction and susceptibility of the host. This has a lot to do with your immunity or predisposition. Are you already sick? If you're already sick, you're going to be very susceptible. If you have a bad immunity, you're going to be very susceptible. If I exercise regularly, if I eat my fruits and vegetables, if I get a lot of sleep, what happens to my susceptibility?
It decreases.
It decreases, right? Because I'm more stronger and I can ward off these infections a lot more effectively than someone who doesn't. Okay, so those are your 4 characteristics. We also have non-harmful organisms. Remember the yin and the yang. We've got good pathogens, we've got good microorganisms, we've got bad microorganisms known as pathogens. The good ones are found like in places like your normal flora. Your intestines are full of bacteria, but good bacteria. It helps in the digestion of the food and products. Very, very good. However, if they are relocated from its normal habitat, they become very lethal. So if it escapes the intestinal tracts and is introduced somewhere else, it can be dangerous and lethal. One of the things that can cause is a urinary tract infection. Let's talk about the females. You've got 2 orifices in close proximity. Okay, right? You've got your vaginal canal and urethra in close proximity to the anal canal. Everybody agree? How is it that you're told to wipe? Front to back or back to front?
Front to back.
Front to back. Why not back to front? Because it's gross. Because of this. Okay? You're told to go from front to back because if you go from back to front, you may be bringing some of that bacteria into your urethra, causing a urinary tract infection. Okay? It's also bad that if you have, because again, microorganisms live in a certain type of population. There's a certain amount of number of microorganisms that exist. However, if there's an overproduction of that type of microorganisms, although they may be good, if there are too many of them, it can be a problem. Okay? Such as your Staphylococcus. Too much of a good bacteria is bad and can cause infections. But these good microorganisms can also be found in sewage and waste. It's also used in the production of things that we like to eat and drink. Like beer. Do we like beer? Do we like wine? Do we like alcohol? Do we like that buzz? Okay, that comes from your microorganisms. It's also used in producing like yogurt, okay, cheese. How many of you guys like cheese? I love cheese. Okay. Fermentation to produce ethanol and other liquid types of fuels, and also probiotics. That seems to be the big thing now, right? Everything that you buy has probiotics. What are we doing with probiotics?
Helps the digestion.
Okay. We're helping the digestion by helping out the bacteria that exists in your intestines. Okay. All right, let's talk about the different types of microorganisms, or more specifically, the pathogens, bad microorganisms. Okay. The first one here is bacteria. Bacteria are single-celled organisms, and they are prokaryotic, which means that they lack the true nucleus and organelles. These are specialized structures within the cells, including the mitochondria, the chloroplast, and lysosomes, etc., etc. So they lack a true nucleus and the organelles. They have genetic material consisting of a single loop of double-stranded DNA. What is DNA?
Our genetic code.
Okay, it's the code. It tells your cells what to do. there are a set of instructions of what the cells do. Without that code, the cell wouldn't know what to do. So even bad microorganisms have a single strand of DNA. It needs a function. It needs orders to operate. Now this is the one thing about bacteria. When you have a bacterial infection, they have a high rate of population growth and they divide every 20 minutes. If you have a bacterial infection, you get sick rather quickly, almost immediately. And because they're rapidly dividing, it takes a longer time for you to heal if you have a bacterial infection because they're constantly multiplying and dividing. 20 minutes, every 20 minutes. Now you've got special types of bacteria that have a protective covering. Kind of like their own line of defense. Remember what it says on the dial, on your soap. It says 99.9%. Some of these continue to exist because they have a protective barrier around them. These are known as endospores. If they have this protective coating, it prevents any type of chemical solutions from killing or destroying the bacteria. So chemical and physical agents are usually not good if you're an endospore. This is your 0.1%. The only way to get rid of this endospores is by way of sterilization. Okay? They can be viable and dormant for many years, which means that they can be active for a while, and then what they can do is after that they'll just kind of lay back and chill for a little bit until the correct set of factors or what do you have here? Conditions cause it to trigger and become deactivated. So they can remain in your system. In fact, all of us are walking beds of pathogens. We just don't present them or we just don't show the symptoms is because we have a very strong immunity. But once the immunity breaks down, that can be the correct trigger to cause the bacterial infection again. You guys follow? Okay. So they can remain dormant for a while, but they can be reactivated. All right, fungus. Fungus can either be large or small. They can be large or macroscopic, like your mushrooms and puffballs, or they can be microscopic, like your yeast and molds. So they can exist large or small. They are eukaryotic, which means that they have a nucleus and also organelles. Okay? So they're a little bit more complex. They're not very simple, but they're a little bit more complex. Now they exist in two forms. Okay, they're large and big, but they can also exist in two forms. First one here is single cell like a yeast, or they can be in the form of a filamentous hyphae. Very similar to that of a small plant or tree. You have a stem and then it branches out into different branches or even smaller branches. Now it's at the end of these branches that you're going to find these spores. Remember the spores we were talking about? The spores is the reproductive part of that particular germ. Okay? So spores is the reproductive part of that microorganisms. They are lightweight, they are resistant to drying, and they can be easily dispersed to new environments by a simple wisp of air. So they can originate from one place, but a simple wisp of air can cause it to move to another environment, or it can attach to clothing, or it can attach itself to some kind of inanimate object. Okay? But they can be dispersed from one environment to the next through these spores. You guys follow? It's the reproductive part. Now, let me tell you a story. Twin cousins of mine, a few years ago, I'm going to say more like 7, 8 years ago. Twin girls, one of them got super sick. Okay, she was vomiting, got dizzy, went to the hospital often to figure out what's going on with them, but the initial thought was because she also just started college, okay? So they figured she was probably just partying too hard. Okay, you're in that environment and you're partying a lot. However, the symptoms continued and they continued to get worse. So now she was having violent diarrhea, violent vomiting, so she was also dehydrated. She would go in and out of lucidness, so mentally she was there and sometimes she wasn't. She would go into seizures and convulsions, which increased as time went on. And the doctors continued to do labs on her to figure out what was going on. Obviously, there was some kind of process going on because her WC count was increased. They just didn't know the origin of it. So they know she was sick, they just didn't know where it was coming from. Okay? So this continued on for months